For the past 35 years, I've been a science writer, working specifically in the oncology community. Over that time, I've published probably 500 or 600 bylined articles in major cancer journals. I've also interviewed 500 or 600 of the leading cancer experts in the world, including 5 Nobel Prize winners. In 2014, I co-authored a book called The Great Prostate Hoax: How Big Medicine Hijacked the PSA Test and Caused a Public Health Disaster. My co-author was Dr. Richard Ablin, one of the primary scientists behind the discovery of PSA. I say that not to brag about my credentials, but just to let the audience know who I am, because what I'm about to talk about later on in the story challenges a $200 billion per year cancer industry. And anytime you challenge that type of power structure, there's blowback. They will try to discredit me, but they can't because I'm an insider. I'm one of them. My road to science writing was unconventional. I didn't go the usual high school, college, career path. I grew up in Syosset, a town on the North Shore of Long Island, New York. It's called a commuter town because it runs along the spine of the Long Island Railroad. I came from a very dysfunctional and poor family. My mother was bipolar. She was an original conspiracy theorist. She claimed to be abducted by a UFO. When John F. Kennedy was assassinated, that was sort of her tipping point. Any maternal instinct, the little she had, vanished. And so I was basically on my own at an early age. My father waited tables at a German-American restaurant called Rothman's. And when I was 14, I started working there. And I was making about 40, 50 bucks a week. So that's 1967. So I was doing very well. I was on my own. And by 15, I'd established myself as a man. I was self-sufficient. And 2 things were very prominent in my life: hard work and hard drinking. I could do both of those, and that would define much of who I later on became. So I always had a keen eye for adventure, and at 15 years old, I, with a buddy of mine, this guy named Terry McQuaid, we hitchhiked down to Florida to visit my uncle Asa, who was an orange picker. He lived out in the outback of Florida in a tin-roofed house set up on cinder blocks with 12 kids, my cousins. There was no indoor plumbing. I was poor, but this was Southern dirt poor. It was a really wild experience. They were so far removed, and this is 1968, they were so far removed that my cousins had never heard of the Beatles, okay? So we picked oranges for a few weeks, and then we took a train back. After that, I didn't go to college. There was never any talk of college in our household. We didn't have any money, and it just wasn't part of the discussion. So I had an opportunity. I went to Paris, and I lived in a flat on Rue de Mosque, right by Gare Saint-Lazare. And I worked at a place called Hediard as a prep cook. Hediard was a very, very high-end emporium, food emporium. And I did that for about a year and a half, and then I came back and bounced around as an itinerant cook. I ended up back in Rothman's, where I originally started. And as it happened, there were some Norwegian shipping brokers that used to drink there. And I buddied up with this guy named Captain Morlandstow. He was a hard drinker, as I was, and we started talking, and I wanted to follow my childhood literary heroes and go to sea. But at that time, our merchant Marines was the size of a dime, and they were all unionized. It was impossible to get on. So I begged him. I said, literally begged him. I said, can you get me on a ship? And he said, well, we're shipping brokers, but we do own one ship. She's called the Sovereign Edith, and right now she's dry docked in New Orleans. He said, but he was very frank. He said, I would not, in good conscience, send you aboard the Edith because she flies the Liberian flag, and it's a very dangerous environment, especially for an American, a white American. But I prevailed on him, and I finally said, okay. So I joined the Sovereign Edith, and it was a wild experience. The crew was a collection of very poor, ignorant, proud, and violent men. And we sailed the dangerous waters of the Caribbean. We had ports of call in Central and South America. And after about a year and a half, we were port in Puerto Limon, Costa Rica, picking up mahogany. And I got very sick. I had a peritonsillar abscess that went septic, my whole systemic, my whole body. I couldn't move. I had to be rushed to the clinic there, and they did surgery on me. It was a very primitive place. And I tell people this story, and some people look at me with disbelief. I was in the operating room, and instead of stainless steel, what you'd expect, because they're going to put the IVs on, there were two wooden planks. And they put me on like my arms like that. They put the planks out. The surgeon comes in, and he has long black hair, and this is the God's honest truth. He's in the mirror looking at himself, and I'm on the table looking at him like this. He's in the mirror and admiring himself as he's having a nurse help him put the cap on, and I see him slap her backside, and this is my surgeon. But he did a great job. They saved my life. And so the shipping company sent me after that to San Jose to convalesce. And I was drinking about 3 bottles of good wine a day there. So after about a week, they said, no, you're going to rejoin the ship in Cartagena, Colombia. But for reasons that beyond the scope of this discussion, it wasn't a good idea. It would become too dangerous for me. So I was standing outside in San Jose with about $6 or $7 in my pocket, and these 2 young guys came up. One guy introduced himself as Luigi Kanaka. He had a broad smile, beaming, and he asked if I was an American. I said, yeah, I guess it shows. And he said, well, we're students. We were in Panama, and we're going to our place in our home in Miraflores, Honduras. Do you want to come? Well, my calendar had plenty of blank spaces on it, so I said, sure. So with the remaining money that I had, I bought a bottle of rum, a hand of bananas, and a pair of shoes for Luigi off a street vendor, and off we went. And we went in across Costa Rica, into El Salvador, and then across Nicaragua. And we were walking 20 to 30 miles a day, and Luigi would beg a ride here or there with a truck or a bus or something. And we'd go for several days without eating. It was a wild experience. It took us about 14 days. And through Nicaragua, at that point, it was after a devastating earthquake, and it was the rumblings of the of the Sandinista revolution against Somoza, the autocrat. And so it was under martial law. It was a very dangerous condition. But I met some of the most beautiful people I'd ever met, the poorest of the poor, and they'd give me, tortilla with some frijoles, and I'll never forget it. With hallucinogenic recall, I can still see. We were walking by this abandoned highway, and out of this ramshackle shelter built of, tin and cardboard, these little kids come walking out, and they're stark naked. And then I see the mother come out, and then the father. They were all naked. It was the most bizarre, heart-wrenching sight you could see. They just stared at us as we walked by. But throughout this whole thing, Luigi Kanaka would sing opera or tell jokes. He was an incandescent human spirit that just kept us going. And then we it took us about 2 weeks. We finally made it to Miraflores, Honduras. And he put me up in his house, and I got a job at a taco joint there for a few weeks and saved up some money and flew back home. After that, I did the itinerant cooking thing, bounced around, went to Florida, New York, and I ended up at this place in Oyster Bay called Uva's restaurant. I was working as a sous chef there, and I met a beautiful girl and fell in love, and we were married. But I was going nowhere, bouncing around, and then I had the opportunity arose to open up a restaurant. A high school guy that I knew was working as a bartender found me and said, you want to do this joint? We had no money, but we got money together. It was a wild experience also because his father had been a very famous, they call him Tin Man, but in replacement windows business, became a multimillionaire, but then for reasons, business reasons, it went south. He ended up robbing 5 banks. And he became a famous bank robber in New York called the Gentleman Bank Robber. He was a fascinating character. And the guy that ended up bankrolling us, this guy TC, was a Wall Street guy who also did a 5-year bid upstate for wire and mail fraud. And my main guy in the restaurant, Bob Kang, who was the son of Young Hill Kang, who was shortlisted for the Nobel Prize. He was AWOL from the Marines. So you get the picture here, 2 ex-cons and an AWOL Marine. But we made it, and it was an interesting ride for 5 years, and we got a great review and did some good business. We sold it for a bunch of money. But then I was just doing physical manual labor, and then again, several years later, he came back and said, "You want to do another restaurant?" It was a bad idea, and we went into another underfunded venture called Ron Piana's Cafe in Syosset by the train station. And it was a black hole. It was a cocaine den masquerading as a restaurant. And in the 3 years that we had it, I think I brought home $9,000. So my family was living far below the poverty line, the federal poverty line. But my wife always, she kept her chin up, and we kept moving forward. I do remember one thing, because the kindness of strangers has always impressed me. During this time in Ron Piana's, on my way home, I'd stop at this little court and shoot baskets just to blow off some steam, and I'd generally take my wallet and watch off and so forth. And on this particular day, Lou had given me $80, my partner, and it was $80 was like $5,000 to me at that time. And I'm 3/4 of the way home, and I realized, my God, I left my wallet at the court. I turn around, gun it back. It was gone. I get home, and I was disconsolate. My wife, again, took it on the chin, can't do anything about it. And I was in the shower. She came in and said, "Ron, the 2nd precinct called. The desk sergeant said some guy brought your wallet in and has $80 in it." By the time my hair was still wet by the time I got there. I was just shaking with joy. And he said, "Yeah, this young Hispanic guy came in, and I knew he was an illegal, but I had to ask him his name." And he said, "Jose Diaz." He just like, "Oh, what's your name?" "Joe Smith." And he was terrified, but he gave me the wallet. And I thought after that, here's a guy that found this wallet sort of in the middle of nowhere with $80 in it. That's a week's salary for him. He's probably pushing a lawnmower. Yet he took the risk. Instead of just pocketing the money and throwing the wallet away, he took the personal risk to go to this police station and turn it in. And my father always did tell me, he said, everybody has a story. It's not an excuse for bad behavior, but it explains it. But everybody has a story. And I never became a judgmental person because of that. But this guy, Jose Diaz, whatever his name was, did that for me. And I've told this story 1,000 times because it's important to think about things like that. So we were going out of business at Ron Piana's, and I didn't know what I was going to do. And I had a customer there by the name of George Rossetti. Like myself, he was a hard drinker, and we drank together, and he's a good guy, very smart guy. We shared literary stories together. And he asked me, he said, "Ron, what are you going to do after this restaurant closes?" And I said, "George, I haven't the faintest idea. I'm done with the restaurant. It's over. I'm burnt out, and I just don't know what I'm going to do." And he said, "Well, would you consider becoming a proofreader?" He said, "I'm a medical editor, and I work for this company called PRR. It's a place in Huntington. They publish cancer journals." Well, I said, "Sure." I said, I'll try anything. That sounds good. So I said, "But George, I never went to college. I don't have a college degree." He said, "Don't worry about it. The medical editor is this guy, Jim McCarthy. He's a crusty old Irishman. Just dazzle him with some stories, and it'll work out." So I did. I went there and met Jim. We connected right away, and I took a proofreading test, and I aced it. So I was hired a week later for $34,000, and my wife was ecstatic because for the first time ever, I had a career, and I was surrounded by well-educated, well-mannered squares. It was good. It was good for the family. But I was a voracious reader, and I always studied. I made a point every day to spend an hour studying. So as I was proofreading, I studied all about cancer. I studied the biology, the economics, the politics behind it. And I quickly rose through the ranks. From proofreader to editor to senior editor, managing editor, and then I became a freelance writer. Also, I began doing interviews, and everything was good. It was great. We traveled across the country. My wife would attend cancer meetings with me. We'd go to Orlando, New Orleans, Chicago, San Francisco, et cetera. It was just a great time. But after a while, something began to not feel right with the industry I was working in. The money, the pharma money, had too big of a presence. There was something there, and I'd see these meetings, I'd see the doctors presenting, and I'd see their names on the presentations and the pharma companies and the consulting fees. And so it was unsettling to me. I think the first inflection point came, I got a side gig with this guy, Bob Ross. He had a small medical publishing company. And he said, look, there's this company, they want to get into, they want to break into the oncology sector. And they have a new drug in a phase 1 trial. They want me to come down with you and write a white paper on it. I said, fine. We went down there, and they had assembled a group of doctors, consultants, and they were presenting the data from this clinical trial. Now, drugs go from a laboratory, they go into phase 1, then phase 2, then phase 3. Phase 3 is the randomized controlled trial. It's the most important. That's what the FDA looks at when they approve or disapprove a drug. So they were in phase 1 clinical trials, and it was a trial on pediatric brain tumors, kids with brain tumors. And I'm listening to the presentations, and the way they just talked about these kids, subjects, and but I understood that. This is a clinical trial. But then I would hear words like harmonize the data and clinically meaningful activity. And I was fairly young in the business at this time. And after the meetings, each night we were there for a couple of days, I'd say to Bob, what's going on with this harmonizing the data? Clinically meaningful activity. He said, they're just looking for something, any activity, anything to move this on. And I said, but it's not affecting the kids at all. It's not. He said, no, it won't. They just want to move their drug to phase 2. And I realized that the agent that they were testing on these kids had no chance, or as close to zero chance as you can get, of having any benefit for these poor kids, okay? One of the side effects, I read the side effect profiles of this terribly toxic drug was suicidal ideation. Just think, a 12-year-old kid contemplating suicide because the drug they were giving him was so toxic. I asked Bob, I said, look, why would they spend money on this drug that has no chance of benefit? And he said, well, all they're looking for is some activity. So you can put a placeholder right there, and I'll get back to that, why that happens, okay? The next inflection point was I was attending a meeting, the ASCO meeting, American Society of Clinical Oncology. It's the largest cancer organization in the world, about 40,000 members. Very powerful, very politically connected. And at this time, I'm attending the meeting, and they have what they're called poster sessions. The poster session, now this is the size of a football field, this arena it's in, the poster session. And it's lined with posters that are 4 foot by 6 foot up on posts. So they're just straight line. The posters are essentially abstracts. They consolidate what was presented at the meeting, what the particular person presented. And I was walking by this one, and it was presented by Amgen, the pharmaceutical giant, and it was for this drug called Aranesp. And I had what I call the Toto moment, like in The Wizard of Oz, when Toto pulled the curtain and he saw the fake wizard. As I was walking by, the famous oncologist named John Glaspie, tall, imposing man, was talking to his associate. And he said verbatim, what we need is a drug that fucking works. And that got me. And our eyes glanced a little bit, and just we went off. I kept on my way. And so Aranesp is a drug, it's called an ESA, an erythropoietin-stimulating agent. Erythropoietin is a hormone produced in the kidneys that stimulates red blood cell growth in the bone marrow. It became famous. That's what Lance Armstrong did. An EPO drug, that's what he got busted for in the Tour de France. So it's used to treat anemia. And Amgen got it approved for chemotherapy-induced anemia. Okay, it was a very difficult approval because it's a growth factor. And anytime you enter a growth factor into the cancer setting, because cancer is unregulated cellular growth, there are many problems. One of the expert panel it was leaked that he said, I hope we're not approving miracle grow for cancer. Okay, but they did approve it. But Amgen wasn't satisfied with that market. They wanted a blockbuster, another blockbuster. Now, in cancer lingo, a blockbuster is a drug that generates at least $1 billion per year. So they wanted the other market in cancer, the bigger market, fatigue. Cancer fatigue is the most dreaded symptom cancer patients have, even more so than pain, because pain can be treated with opioids. Cancer fatigue, there's no treatment for it. And it's not like being totally exhausted, like, oh, I'm exhausted. It's cancer fatigue takes you into an otherworldly sense. The world outside you is moving at one speed and you're locked in place. It's soul-searing. So any drug that helps this would be a blockbuster. The problem was that Aranesp didn't work. Okay. Instead, but the FDA still approved it, and Amgen began direct consumer marketing of this drug that had very dangerous side effects for cancer fatigue. So later on that night, I went down to the hotel bar, and I'd seen the Amgen reps, sales reps, and these are very slippery people. They're mechanisms, okay? I mean, they're just simply mechanisms working for the company. I was there and talking and listening to them, and I'd done some amateur boxing when I was a kid, young guy, and they were talking about boxing. So I made a correction. I corrected it. It wasn't Marvin Hagler, one of these things, just to sidle up and have a conversation. So we started talking with this guy named Tom, and I dropped in as an aside, said, wow, you guys hit another home run with Aranesp, blockbuster. He said, yeah. He said, the docs love it. They can't get enough of this shit. I said, why? And he said, well, it's $2,600 an injection, in-office injection. Bang, $2,600. Bang, $2,600. He said, they're making a fortune. We just can't get enough of this stuff to them. So I waited a little bit, and then sort of jokingly, I said, yeah, but it doesn't work. And I'll never forget, he paused for effect. And he said, if you're putting your kids through Stanford and looking at a waterfront property in Malibu, it works. And my spine just cringed. That was my tipping point when I realized that the incestuous relationship between pharma and the oncology community, the healers, had been so corrupted by their money that everything had fallen off the cliff. So that was the real tipping point for me. And I began doing a lot more investigation. I contacted my sources on the Hill that I'd met during the writing of my book, and I kept moving along. I'm going to use one drug to illustrate what I'm talking about, the corruption in the system. It's called Avastin. But before I do that, I just want to put something into framework here. Number one, there are thousands of really good people in this industry. Oncology nurses are at the top echelon of the most compassionate and dedicated people in the world, okay? I'm not bashing them, but the problem is that they're caught and working in a system that has been so corrupted by medicine that in some ways they're complicit, either aggressively or passively complicit in this system. The other thing I'd just like to mention, people say, well, we've made great advances. There have been advances. There have been tremendous advances in childhood leukemia, for instance. That's the biggest home run in cancer. And in phenotypically specific cancers that react to a certain targeted drug, there have been some good responses, okay? There's definitely. The bottom line is that people die of metastatic disease, and more than 610,000 Americans died last year of cancer. 610,000 Americans will die this year and the following year. That is not a great success story. The other thing that I'd like to mention is that much of the decrease in mortality that's quoted by the oncology press machine has been because of decrease in smoking, because lung cancer still remains the #1 killer of both American men and women. Just wanted to get that, make that very clear before I moved into Avastin. So Avastin is a drug that illustrates this system, the corruption in the system, probably more so than any. So there were years ago, I used to carry around a full-page ad in the journal I work for, and it showed it's by Genentech. So Genentech was the first biotech company. It started in 1976, and they did some very interesting work. But then, they had a couple of good drugs, and things rolled from there. So Genentech developed Avastin, and it's an angiogenic drug. Anti-angiogenesis drug. Angiogenesis is the formation of blood vessels. That's what angiogenesis is. And anti-angiogenesis is it stops the formation of blood vessels. In theory, because tumors need blood vessels to expand and to keep growing. So in theory, Avastin, an antiogenic, stops the formation of the blood vessels and kills the tumor. It's a very elegant theory, but it doesn't work. So I showed this guy Fred, who was a retired doctor. He ran a large healthcare system in Manhattan. And I showed him the indication for Avastin. And I said, look, it's in glioblastoma. Glioblastoma is the deadliest brain tumor. So if you're unfortunate enough to be diagnosed with glioblastoma, you'll have surgery, a resection of the tumor, and get at about 97%. This term they use, we got it all, it just doesn't work. The tumor cells are microns across. They don't get it all. So they consider 97%. They resect the tumor. And then after that, you'll go on recurrent sessions of radiation therapy and a drug, chemotherapy called temozolide. Temozolide was developed 25 years ago. Okay, when the cancer recurs, you'll be given this drug Avastin. Okay. Your usual survival in glioblastoma, unfortunately, is 12 to 18 months, no matter what they do. But when your cancer recurs, now just picture yourself. You're a desperate person with a deadly brain tumor. You get the word the cancer's returned, but we're going to give you Avastin. So I showed this guy Fred. Here's the advertisement from Genentech for Avastin. I said, look at the fine print, and there from Genentech's own data, it said there are no data that show that Avastin increases survival or helps symptoms. So it does nothing. Fred just looked at me and said, how is that possible? How did it get approved if it doesn't work? If it doesn't improve survival or improve symptoms, how did it get approved? And that's the multi-billion-dollar question. It's important to note, I don't want to get wonky about this, but two things happened in the 1990s, early 1990s under George W. Bush. Number one, George W. Bush signed the Prescription Drug User Fee Act. Prior to that, the FDA, like all government agencies, got its money from taxpayer dollars. The Prescription Drug User Fee Act made a union between the pharma companies and FDA. Anytime they had a new drug application, they would pay to have it processed. Some of these things cost millions of dollars, okay? So now they have a financial interest. The FDA, right now, I think about close to 70% of their total budget is from drug companies paying to have their drug applications looked at, processed. The other, even more pivotal thing happened was we went from, the FDA went from using overall survival as its endpoint in approval. Now, overall survival is very simple. It's survival. So if I have a drug, my drug is drug B, and here's drug A. I have 100 patients on drug A, 100 patients on my drug B. For overall survival, you want the patients on drug A, those people, to die sooner than yours. If they die sooner, you have overall survival. The FDA was looking at only 2 months overall survival for their criteria. They couldn't get it. They couldn't get 8 weeks in survival on these drugs. So no drugs were being processed. So they went into what's called, They went into what's called surrogate endpoints. Surrogate endpoints, and one of the surrogate endpoints, for instance, is called response rate. In response rate, you'll have 100 patients on taking the drug. And they'll do a radiologic scan. If there's any activity where the tumor might shrink a little bit, out of, say, 20 out of 100, you have what's called a 20% response rate, and your drug will get approved. It does nothing for the patient, okay? It has no survival benefit for the patient. It's just some activity on a radiological scan. With that, these drugs, like Avastin, began to be approved. That's how Avastin got approved. One of the most telling parts of the Avastin story is in breast cancer. In 2008, the FDA gave an accelerated approval for Avastin in metastatic breast cancer. These are women with advanced breast cancer, desperate women. Now, prior to doing this, the FDA consulted, because it's on high-profile cases like this, the FDA consults it's a board of experts, ODAC, okay? It's the advisory committee. There's 15 experts on this committee. They voted strenuously, do not approve Avastin in breast cancer. They were basing this, they were looking at this trial called the E2100 trial. And the data showed that it was not safe and effective, and that it did not extend survival. They said, do not approve it. Despite that, Janet Woodcock, who was the head of CDER, Center for Drug Evaluation and Research, approved this drug, despite its own expert panel telling her not to. So the drug went on the market. I believe about 17,500 women were given this drug over 3 years. In 2011, then Commissioner Margaret Somberg revoked the indication for breast cancer, citing that follow-up trials confirmed what they already knew: the drug was not safe and effective. So for 3 years, these helpless, poor women across the country were given a toxic placebo. Okay? Now I want to make a point here. At the time of this approval in 2008, Andrew von Eschenbach, very interesting guy, I profiled him, very interesting man, he was the commissioner then. He knew it didn't work. Richard Pazder, they call the oncology drug czar, probably the most influential person in the oncology drug approval process over the last several decades. He knew it didn't work, and so did Janet Woodcock. They all knew it, okay? That is a case of legalized medical malpractice that is breathtaking. The story gets worse. Now we go to the healer's side. There's an organization called NCCN, National Comprehensive Cancer Network. As opposed to ASCO, which has 40,000 members, the NCCN, their members are comprehensive cancer centers throughout the country. I think right now their membership is about 33. To be a comprehensive cancer center, it has to be designated by the NCI. It's a huge deal. Memorial Sloan Kettering, MD Anderson, Dana-Farber, all the big ones. So that's their membership. They're extremely well connected. Take a sidebar here. What happened in the 90s also, they had this guy, Bill McGivney, and he was the CEO of NCCN. And he did something using political strings. He got the NCCN, now they make what's called practice guidelines. They're the guidelines that the doctors across the country basically use in treating all their cancers. They go step by step on what to do in the relapse and so forth, all the way to death, palliative care. They're highly touted. These are the gold standard guidelines. So this guy, Bill McGivney, worked his magic, political magic, and he got the NCCN guidelines worked into the CMS compendia. The CMS uses compendia, there's compendiums. These are these books that they use that guide their reimbursement guidelines. If it's in the compendia, CMS reimburses for it, no questions asked. So now NCCN, their guidelines are part of CMS, part of the Medicare reimbursement. After Somberg, FDA commissioner, revoked Avastin for use in breast cancer, Robert Carlson, who was head of the NCCN Breast Cancer Guidelines Committee, after what he publicly said, we had a marathon session and we've concluded unanimously, 20-0, to maintain Avastin in our guidelines. Now, what could they have found that the commissioner of the FDA didn't find, that revoked the license? Nothing. The data were very clear. It was safe and ineffective. The elephant in the room is Genentech, the maker of Avastin. And it's right there. Genentech is a sponsor of NCCN, and many of the people on that very committee, the guidelines committee, get money from get money from Genentech, whether it be from consulting, or travel fees, or running clinical trials. So that's the ugly side of this. It is very important, and I want to be clear about this. All of these people knew that this drug does not work. It does not extend the lives of these poor, desperate women. Okay? The pharma companies, they're there for one thing, to make profit. They have a profit over patient ethos, and that is solid gold. Okay? They do anything they can, anything, to get their drugs approved and to get their drugs on the market. Now, it's beyond the scope of this talk, but you can just Google, take Amgen, take Genentech, any of these companies, and you'll see lawsuits involved for criminal wrongdoings, okay, of falsely advertising their drugs. So it's the healers who are responsible here. Robert Carlson, NCCN, the doctors at FDA that approved this drug, okay? That is how deep the pharma ties are. And, it's interesting because I've used terms like, pharma industry acts like organized crime, and people say that's hyperbolic. I'll give you an example. The company Celgene. In the 90s, Celgene found a drug called thalidomide. They didn't find it. Thalidomide is the infamous drug that caused the terrible flipper babies, the terrible birth defects. It was developed by a company called Chemie Grünenthal. And the developers of the drug were Nazi chemists, Nazi war criminals. That's how soiled this whole story is. It was taken off the market, but it had some efficacy in leprosy, they discovered. So this company, Celgene, got the rights for thalidomide. They used their white shoe law firm. They branded it. So they got thalidomide. They started to use it in leprosy. It cost pennies, 10, 11 cents a pill to make. They were selling it, I think, for $6 a pill. Then they saw an opportunity in the cancer market, in myeloma. Myeloma is a plasma cell cancer that has no cure. And thalidomide has mild immunomodulatory effects and some anti-angiogenic effects. And there's a place for it, sort of. Anyway, they got this approved to treat myeloma. Now, mind you, this is a drug that costs pennies to make. They rebranded it, and thalidomide it's called phthalimide, and then the other one is called Revlimid. In Revlimid, all they did was they took out one oxygen atom and added a nitrogen atom. All of the R&D that they say cost so much money was done by these Nazi war criminals. Phthalimid, which costs pennies to make, they sell for $200 a pill. Revlimid, they sell for $700 a pill, okay? Revlimid comes to about $17,000 per month, okay, per cancer patient. They were bought by Bristol Myers Squibb, and the price kept going up. So I use this analogy when people say, well, how could you say it's an organized crime? Well, let's just think. They have a captive audience, desperate cancer patients. It's like if there was a terrible drought, and people were dying of thirst, but I was the only person with water source. And I started selling the water. Yeah, I'll make a few bucks. The water cost me 11 cents. I started selling it for 50 cents. But then, I've got a captive audience. I rise the price up, and start selling it for $200, $400 a bottle. Okay? That's what organized crime does. That's what pharma did with this pill. That's what pharma does across the board. Okay? And we've allowed this culture to happen. To fully understand the journey from healer to wealthy pharmaceutical agent is illustrated again with Avastin. Susan Desmond Helman was a famous oncologist. And I've interviewed her, lovely woman. She had an interesting story also. She was an idealistic young doctor at the beginning. Her husband was an infectious disease doc, and they were in Uganda during the AIDS crisis and did a lot of really good stuff. Then pharma comes along. It's so seductive what they do. So Susan Desmond Helman she started to work in global development for Genentech. She was hired. She became the leading voice of Avastin, in the development of Avastin. She left in 2009 When she left, she was making $8 million a year, and she left with a $250 million compensation package. Think of that. She became an extremely wealthy woman. Another famous oncologist came in right after her, another female doctor called Sandra Horning. Okay, Sandra Horning came out of Stanford. She was a lymphoma expert. She was hired by Genentech, global research and development head and so forth, and she championed Avastin in breast cancer. She'd been a former ASCO president also, so she was at the height of her career, and that's the gold for pharma. They look for doctors like that because they have tremendous influence. Sandra Horning, also a lovely woman, a tow-haired, colored woman from the Midwest beaming with optimism. I profiled her for a journal I worked for, interviewed her several times. She was hired by Genentech, and she began to champion Avastin. Even after Hamburg began to revoke the indication, she was on Capitol Hill. She was at the FDA championing this drug, a woman who knew that the drug did more harm than good for these desperate women with breast cancer. Yet, she was a vehicle for the pharmaceutical company Genentech. She ended up, she worked there for several years and then moved on to another. I think she's working for Gilead now. They go from one pharma company to the other. And the line they always use is, you're going to pharma. Actually, the salespeople say, I'm going to the dark side. They're honest enough to say that. The doctors always say, I'm broadening my horizons, okay, by going to pharma, where I can have global reach. A $250 million compensation package gives you plenty of reach. So that is the incestuous relationship that has developed in this industry. And because of that, they've built a dogma wall, a fortress around there are plenty of very promising avenues of therapy out there. But they're blockaded by the FDA, who says, well, they haven't been through this clinical trial. Think of the irony. Think of the irony here. Oh, that hasn't been proved by the gold standard clinical trial. The same gold standard clinical trial that Rick Pazdur, that Janet Woodcock, that Margaret Somberg use to approve drugs that don't work, that don't have any survival benefit, that are actually toxic placebos. And the majority of cancer drugs that are being approved right now do not extend life. That's a hard pill to swallow, but it's the truth. So there's a huge problem here, and it's a triumvirate. Okay, it's the FDA, it's pharma, and the oncology community, the healers themselves, that are warped into this sphere. It seems like an impossible challenge to pierce this armor that they have, because their messaging is so powerful. They create this semantical illusion for the public, and the lay public, don't have this knowledge about this. They're out in the dark. Just think, this doctor that I showed, a well-known doctor, that showed him that the Genentech's own data state that Avastin does not extend survival or improve symptoms. He was shocked by that. So the lay public is in a totally different world. They're not within this sphere. So it's a tremendously difficult task. But I truly believe that we can, through information, through awareness, through the opportunity that Mark has given me right here to speak directly to the audience, the public, about this and share my knowledge of it, that we can make a difference. We can change this system. It's going to be an uphill battle, a tremendous uphill battle. They're intimidating people. These pharma companies, they spin tales. They're as cool as blue smoke. And they spin these tales. They have a very carefully crafted messaging department, okay? And they're incredibly intimidating. They're powerful people, but they can't intimidate me. It's impossible. They cannot intimidate me. This awareness must come out, and I'm very glad to have had the opportunity to share some of this knowledge with you. We're going to win here. Peace.